Hello, good afternoon. Welcome to Voices of Courage Asia. We are very happy to be back again, and today I am very excited because I have a very special guest with us this afternoon to share a very important topic, right? And for those of you who have not subscribed to our channel, like our channel, go to Voices of Courage Asia or Class Living Facebook page, right? So today I'm not going to waste any more of time because there's a lot to talk about because this is a subject that I personally want to be educated about as well. So welcome on board, Dr. Ida. Good afternoon.
Afternoon.
Yeah, I know you have a very busy morning, so thank you very much for setting aside this time to come and share with us your expertise and knowledge in this specific area, right? Have you taken your lunch, by the way?
Um, Soon.
Soon. Thank you. We really appreciate you. All right, we'll keep this as short as possible, right? So you can have your lunch. Right. By the way, Dr. Ida, she graduated from Glasgow University and obtained her specialist accreditation in MRCOG, right, in the United Kingdom in 2010. Now, Dr. Ida is currently the medical director of the obstetrics. Oh, I never get this right.
Obstetric.
Obstetrics and
Yeah.
Gynecology Center in Mount Elizabeth Novena Specialist Center. So, Dr. Ida, we really love to hear from you about the subject matter. But before we go into that, we just want our audience to get to know you a little bit more, right? I know you have lots and lots of accolades, and maybe you want to share with us a little bit more about yourself, yeah, your journey into this subject matter.
Yes. Thanks, Lily, and thank you again for the opportunity to come and talk to you as well. I'm actually. Where do you want me to start? I was born in Malaysia, in Malacca, actually, and then I got the opportunity when I was 18 to go to the UK and to study medicine, and from there I graduated, as you know, from Glasgow University, and majority of my 20s and my 30s are actually in the UK, in mainly in Scotland, basically doing my specialist training in obstetrics and gynecology. I completed my training there and I came to Singapore. Most likely now it's about 10 years now that I have been here.
Wow.
And interesting thing is that you don't know where you are going, life is going to take you.
Mm,
So I was actually initially trained mainly as an obstetrician to deliver babies, and my advanced training module at the time that all specialists has to take is on labor ward management. But on the other side of it as well is that I was also doing colposcopy, which is a part of cervical cancer prevention. And lo and behold, when I became a consultant in finished my training, I was offered a job, not as an obstetrician, but as a colposcopist, or to lead the pre-invasive gynecology screening, cancer screening and prevention in National University Hospital. And that was way back in 10 years ago. And since then, that's when the passion was there, but the passion was ignited more when I came to Singapore, obviously. And I think the reason is because when you are in the UK, the United Kingdom, the we don't see cervical cancer. United Kingdom has a very organized cervical cancer screening program. It is in their culture that all women, they will go for their regular screening. It's one of
mm,
the life things that they have to take. Okay, every 3 years or every 5 years I have to go for my pap smear, and it is in the mindset of all the women there. It is just normal practice for them. So you don't see cervical cancer very much in the UK, even though I was practicing colposcopy, cervical prevention.
mm,
And so when I come to Singapore and I led the colposcopy clinic in NUH and the pre-invasive disease division in NUH, first week I was there, I was diagnosing stage 3 cervical cancer.
mm,
And this initially was a culture shock because when you always when you have been working to prevent cervical cancer, when and you never see advanced stage cervical cancer anymore, and you come to Singapore, and then you think that, at that time I thought, okay, Singapore does have its own cervical cancer screening. They have all the facilities like the UK have, but now I'm seeing women with cervical cancer and at
Mm.
stage 3, the late stages. And then when you ask them, and the answers are always the same. Either when you ask them, when's your last pap smear, and they say, oh, I've never done one, I don't know that I need to do a pap smear. Or they would say, the last one I did was after my baby was born. And I said, okay, when was your baby born? Oh, maybe about 15 years ago or 20 years ago. So that started to ignite questions in my mind as well, that, to know, why is the awareness, is it just the cohort that I'm seeing, or is it just the awareness for the whole of Singapore that is that we need to concentrate on?
Mhm.
And I do realize that for Singapore, we know that cervical cancer is still in the top 10
Mm.
in terms of the most common cancer in women, and also top 10 for one of the main killers of women.
Mm.
And the thing is, this cancer is preventable. No women should experience this cancer. And after practicing years in the UK, I mean, and all you see is the pre-invasive disease, because the good thing about cervical cancer, for cancer to be good, is basically we can identify those cells
Mhm.
before it becomes cancer. We can easily treat them, or so that the woman continue to not get cervical cancer in future. So
Mm.
I am faced with, week by week, seeing at least one woman with stage 3 cancer, stage 2 cancer, stage 4 cancer. And these are not elderly women, these are younger women in their 30s, in their 40s, when your life is actually just starting. You're just starting
Mm.
a family, you're starting a career, and it gets halted by cervical cancer. So I made it a mission. So that's when the passion was there. It got ignited again. And I just made it a mission in Singapore that, somebody has to start kind of increasing the awareness
Mm.
in cervical cancer prevention. So
Yeah.
that's where I am now.
Wow, what a journey. Yeah. And I mean, personally, I'm guilty of that. When you were sharing, I was like, oops.
Go for your regular.
Yeah, it is due. It is due. I need to go for my pap smear. Yeah.
Yes, a
Yeah.
brush can save you, can save your life.
Yeah. I think yes, this is not something that to be taken lightly of, and I think most of us, a lot of women around, in our, in fact, in our community also, when we bring up the subject matter, everyone was like, okay, yeah, I think we need to be educated about it. Yeah, there's a little awareness about this. So we really appreciate you for setting aside the time to come and educate the community. Yeah, just like you also mentioned about Glasgow, and I just want to go back to the your initial.
Let's go with my heart.
uh, yeah, I stay in Glasgow for a year with my husband. Yeah, so I'm also very biased. I like Scotland, and we
Yes,
travel. Yeah, we travel
lovely.
around Scotland for a while.
Yeah, I stayed
Sorry,
there for 20 years.
how many years? Sorry,
Yes.
sorry. The voice was cut off. How many
So
years?
it's 20,
4 years. 20,
20.
20 years. Yeah. Wow. All right.
My 20s and my 30s there. So it is home in a way.
Yeah. Specifically in Glasgow, or which part of
Yes, in
Scotland?
Glasgow. Yeah.
In
I trained
Glasgow.
in Edinburgh, but I live in Glasgow.
Mhm. Yeah, we were there last September, right?
Mm.
When we did our tour. Yeah. Okay, so again, before we go back into the subject matter, one more thing would like to know about you. Like our audience would like to know about you as well. Is maybe a fun fact about you, or I know being a doctor, and especially in this specialist area, it can be very, very draining and very tiring. In your days could be very much occupied, and seeing a lot of patients. And how do you unwind? How do you keep your mental and emotional well-being, um, fitness?
To tell you the truth, actually, I do like to cook. And I have cooked since I was very little because my mother makes it a point that you need to learn how to cook.
Mhm,
And um, and that basically is my stress reliever
mhm,
because planning the menu, going to the grocery store, taking, choosing, or is way away, totally different of my day-to-day work activity.
mhm.
So I don't have to think about work. So I'm one of those people that you go to the department store or the wet market, you can just go there and then just choose your ingredients. I do like that. That de-stresses me. If I know it's a bit funny, but then when you come home, you plan the cooking and then you cook, and then when your family comes home to eat dinner, they enjoy your dinner. So that's basically how most of my hobby is cooking. I mean, I used to do Spartan as well, which is an
Wow.
obstacle. Yeah. And before the pandemic, and
Mhm.
used to do it with my son. So my son is now 19, but we used to do every year when he was 14 years old, about 5 years ago. Every year we make sure that we do the Spartan run, the three runs, which is the 5 kilometer, the 13 kilometer, and the 21 kilometer together. And
Wow.
kind of like a bonding and for us as well. And and when you exercise also, it's kind of like something to like stress reliever as well. So those are the two things that mainly that I do.
Mhm.
And yeah, and but you just have to take your work is very, very stressful. It's enjoyable, but it's stressful. But sometimes you just have to go out and do something totally different from what work is. So yeah, so those are the two things I enjoy doing.
Right. Wow. Spartan, run 21 kilometers with your son together.
I'm only 30 minutes behind him for the 5 kilometer, but we haven't, because of the pandemic, it all stopped. So we haven't actually done that yet for this year. So
That's a very good way to bond together. Yeah. And also at the same time to keep fit.
yes,
Yeah. So I think the next thing I'm very curious about is, because our community is all about empowering women to build a very strong mindset, with resilience, emotional resilience, and a healthy mental fitness. It is inevitable that, most of us, majority of us, struggle with negative thoughts in our mind. Um, Even so, those patients that you see all the time. So, what are some of the struggles that these patients are going through, and how can, um, the medical team, or even the community, especially, how can we provide that support?
so I think the main struggle with women, especially when they before they go for a pap smear or after they go for a pap smear and they find out that they have an abnormal pap smear, is the fear that they have cancer.
Mm-hmm.
And it's the fear that if you have cancer, then then life just fall apart after that, because certainly it will be, because there's a lot of uh, cancer diagnosis does impact your life in a lot of ways, especially with cervical cancer as well. If you get diagnosed with cervical cancer, you're thinking, okay, we need to do surgery. Surgery will involve removing your womb, therefore your fertility capability. You may have to go for radiotherapy, you may have to go for chemotherapy. There are also, if it's stage 4, if it's then it's palliative care, you might have premature death. And these are the things that women will be thinking about. But the thing is that um, when you're going for screening, we're not really looking for cancer. We are looking for cell that has the potential to become cancer in future, so that we can take these cells away, and therefore we can still save the woman from cervical cancer. But these are the knowledge that community and women don't yet kind of fully aware of, because when you talk to women, say, have you done your pap smear, they all think, oh, it's because, you know, for cervical cancer, if it's positive, I have cancer, and then they get all worked up. So I think education and awareness is very, very important. The first thing you need to know is to know why you are screening and what you are doing when you are doing the screening. Basically, if you don't know, ask. I mean, you know, you can Google, but Google is actually very confusing and can be a very scary place if you are a lay person and you don't really know what all the medical terms and the medical stuff is. But that's why I think, in terms of you guys, Women of Courage, you play a very important role as well, because you are the connection to all women. And from Women of Courage, then you can spread the word of awareness. The other thing that I think women find challenging is that nowadays we know cervical cancer is due to a virus, which is a human papilloma virus. We didn't know that before, so we don't actually connect an infection to cancer. What we connect is that an infection to, for example, inflammatory disease, or, you know, fever, symptoms like discharges and all that. But HPV, or human papilloma virus, that causes cervical cancer, do not have any symptoms. So we can now screen for the virus, which is actually better, because rather than screening for the cells changes due to the HPV infection, we are now have the technology to screen for the virus before changes happens in the cell. And this is a much better screening. But when women go for a HPV test, and when the doctor says your HPV test is positive, then the word infection brings out a lot of other fears and other thoughts, and just because you do not understand what it's all about. So I think the first thing that we need to do for all women and all men, and I think the community, is to give them a better understanding about cervical cancer, the cause of cervical cancer, why do doctors nag us to go for screening, and then what type of screening and why we screen with either HPV test or a pap smear, and what are the positive tests, what are the implications of the positive test. So these are just, because once you know why you do it, then that fear will usually just, you know, get better, because the reason why you are scared, and most women, some women are scared, they don't really want to go at all. Oh, I don't want to know about the results. But then the thing is, if I know about the results and it's not cancer yet, I can still help you prevent cervical cancer. But if you don't go, I don't know, I can't do anything about it. So there are a lot of barriers to going for screening. Knowledge and awareness is one of them. But we know in Singapore, surprisingly, Lillian, the Ministry of Health has actually done a survey, okay, twice survey. One is, I think, in 2003, if I'm not mistaken, and one in 2019. And they did a survey and they asked women, and these are mainly professional women, do you whether they are aware about cervical cancer screening, about going for a pap smear. And more than 90% of women surveyed says yes, they are aware of the screening, that they have to go regularly. However, that does not coordinate or correlate with our uptake at the moment, because our cervical cancer screening uptake in Singapore is only 48.7%.
Wow.
For last year. So, I mean, knowledge and education is still very important. That is the base. But there are other reasons as well, I guess, that stops women from going for screening. And one of the most common reasons is we are too busy.
Too busy.
You're too busy because I have meetings. I have to look after my family. I've got to send my girls to school. I've got to send my children to school. I'm so busy. So, so those take priority rather than us.
Mm-hmm.
And that's why, for women of courage, you, you yourself, keeps on advocating about looking after oneself first
Yes.
before looking after others, empowering ourselves first before empowering others. And then, and that's what cervical cancer screening is about. Yes, we love looking after people. We're givers. We love looking after people. We like to make sure everybody's healthy. We like to make sure everybody eat properly. We like to make sure that everybody is getting what they want. But then we forget that before we look after people, the first person that we have to look after is ourselves. And
Yes.
all you need to do is actually just go to your doctor one day, just say, look, life, other people's life need to stop. Okay, you need to sort out your own life for about maybe an hour or two. I need to go to the doctor. I need to go get my pap smear done. I need to go get my HPV DNA test done. And then
Mm.
and then and that's all that you need, basically. But we forget that. And that's one of the main reason as well that women don't really go for regular screening.
Mm-hmm.
The other thing as well, we think that a lot of young women as well, they think that because they're healthy, they don't have to go.
Mm.
Which is true. When you're healthy, your immune system is much better at for example, getting rid of the virus. But it does not mean that you are not at risk of cervical cancer. You
Mm.
still need to go. It's one every 5 years. Come on. It's not that you have to go every year. You just have to go once every 5 years to save your life from this cancer. There's one cancer that you do not have to worry about.
Mm. Yeah, I mean, you brought up. In fact, you answer a lot of my questions, which I don't need to ask anymore.
Yeah, I'm so glad not to.
So it's great. It's great. Yeah, fantastic. I mean, just managed to pen down something, and yeah, it's really surprising and not surprising to hear that, just now you mentioned that through the survey, there are 90% who are aware, but only 48.7% actually take the actions to go and do the pap smear and screening, right? Um, so, like I mentioned, um, I think priority, the word priority just comes to my mind. Yeah, even just now you mentioned about taking care of ourselves first before we take care of others. It's simple things like, I mean, this is a very simple theory.
We don't practice it though. We
Yeah,
forget that. Yeah.
yes, yes, yeah, and even in the aircraft, right? If we fly,
Your
the
mask first
put
before others.
your mask first, right? Yeah,
Yeah.
and we forget that. We forget that, and we are distracted by all the busyness in life, pursuing other things in our life, forgetting that, hey, if we don't take care of ourselves, you don't have that luxury of fitness and health to pursue all that you want to for yourself and for your loved ones. Yeah,
Mm.
so priority in putting in the priority for certain things, especially like screening like this. Like I say, it's only once in 5 years. Just
Yes.
yeah. And the other thing that I wanted to maybe ask that you could elaborate on is the numbers, the statistics for women who are diagnosed with cervical cancer are younger women, you mentioned, right?
Yes.
And these are they fall within the age of what are the age range for this?
So between 30s and 40s, we know that if you look at the statistics for cervical cancer in the last probably at least 10 years or so, there
Hmm.
is a worrying trend that cervical cancer is diagnosed more now in younger women. There is an increase in the incidence of cervical cancer in younger women. But then, yes, they are diagnosed at stage one, early stages, stage one, stage two.
Mm.
But still, for me, that is still a very unfortunate event because you should not even go to stage 1 with cervical cancer. Because the first thing is, as you know, for our children, okay, we do have the vaccine, okay, that prevents you from getting infection from some of the HPV virus that causes cervical cancer. And the other thing as well is that the screening is extremely effective. If you go regularly to pick up those cells, the treatment itself is extremely effective to remove all the pre-cancer or the stage before cancer without letting the women go into any major surgery that will impact their life. Treatment for pre-cancer is simple, is effective. It will still allow the women to have children. It will still allow the women to have a life, to see their children grow, to still fuss about their family, their career, and then, without them really realizing, I mean, for all women that actually go for screening, they don't realize that when you go for your pap smear or your HPV DNA test, you're actually saving your life from cervical cancer.
Yeah.
That's how big an impact a pap smear or a cervical screening is. You don't realize it because you don't get it.
Yeah.
Because you only realized it if you get it, it's too late already. We can still treat cervical cancer, but why would you want to treat cervical cancer when you can prevent it?
Yeah, precisely. I think you mentioned one very good point there is majority, a lot of us, we don't really bother about it until either we ourselves got it or people we
Somebody
care, the people, somebody that we know, yeah, within our sphere of influence got it. Yeah, but by then it probably could be too late. Yeah. And just now you also mentioned that there is no symptoms. Or
Yes.
like you can't see any symptoms, and
So
so
we so we know that
mm,
HPV is a virus infection.
mm,
HPV infection itself has no symptoms. It's not like flu or COVID. You have your cough, your HPV has no symptoms at all. The only way you know you have a HPV infection is by going for your screening.
wow, okay,
Then and in most cervical cancer, especially stage 1 and stage 2, will not have symptoms at all. That's why cervical cancer is called the silent cancer, because even if you have it early on, you do not know it. The stage before cancer, which is the pre-cancer, also has no symptoms. You only know that you have pre-cancer if you go for screening, you have an abnormal pap smear or abnormal screening test, then you go to a colposcopist like myself, and then where we do the procedure where we can see, oh, you have pre-cancer on your cervix that we can treat. There's no symptoms for pre-cancer at all. Okay, if women wait for symptoms, and this is what women do, I mean, a lot of people do, and it's basically, I think, just nature that, if you don't have symptoms from, for example, other illnesses like chest infection, you have, you have difficulty breathing, you have fever, you have cough, you have sputum and all that, then you go see the doctor. The doctor give you antibiotics, and then you find, and a lot of other illness. So you wait for the symptoms, but unfortunately for cervical cancer, if you wait for symptoms, and the most common symptoms is abnormal vaginal bleeding, majority of the time, it's already most likely stage 3 or late stages cervical cancer. So I always say to women that, remember, HPV do not bleed, pre-cancer do not bleed, cancer bleeds. So that's why you cannot apply the practice of waiting for symptoms with cervical cancer. That's why we have a national cervical cancer screening program where all healthy women, okay, if they've ever had sexual intercourse in their life, you have to go for your screening. Whether you're healthy, you're not healthy, you've had one partner or multiple partners, you have medical illness or you don't have medical illness, but if you have to go for your screening.
Mm.
Mm.
Yeah, wow. I I think this is something very awakening, like we because there's no symptoms,
No,
and it's not
no,
something that you can. And the usual old pattern behavior is to wait for symptoms, right? And
yes,
and
and
that is
it's
not something
yeah,
that we can deal with cervical cancer. Yeah. So thank you very much for sharing so much with us, even and during this lunchtime chat. And we really look forward to your sharing in more details and at the monthly Empower meeting on the 27th of June, which is the last Tuesday of this month. Yeah,
yes.
and at PSB Academy, the city campus at Marina Square. So for those of you who want to find out more and you have more questions that you have questions that you want to ask Dr. Ida, yeah, you can visit us, right? Just click on the link that comes with this video and RSVP, register for the meeting, and Dr. Ida will be there. Yeah, we will have a Q&A session, and I'm sure you have a lot more questions to check in with her. Yeah. So, Dr. Ida, I would like to leave on a positive and happy note.
And that was so depressing, wasn't it? I'm so sorry about that. It wasn't
No, I mean it is something that we must talk about. Yeah. Right. And because we are Women of Courage Asia, the community is all about courage and leadership, especially, self leadership, leading yourself, especially taking care of yourself, mental, emotional, physical. So, what are your thoughts? What does courage and leadership means to you?
So for me, courage is not just about standing up and facing your challenges in life. I mean, that is courage. But another form of courage is basically just knowing yourself and also um, standing up and reflecting on yourself in terms
Mhm,
of sometimes, I need to change. I need to change, or I need to improve myself. And then that's courage as well, in a way. And
mhm,
then we always say that in terms of courage, we have to have courage to stand up, to say, oh, this is wrong, this is right, this is wrong. But sometimes it's just inner courage that we have to sometimes say, actually, maybe I should listen.
mhm,
That actually this may be right, that I should actually listen to what people are saying. This may be a reflection of me. Maybe I may be wrong this time, that maybe, I may have to change. And that's the most difficult thing, is to change yourself. And I
mhm,
think that's the most difficult courage that we need to practice, because, you know, we don't like people telling us that we are not right, in a way.
mhm,
And then in
mhm,
terms of leadership, and for me, leadership is always about listening, it's about respecting, it's about, and also it's about nurturing, in
mhm,
a way. And as a leader, it's not about you telling people what to do and your goals, it's about teamwork. It's
mhm,
about you listening to the people around you. It's about respecting other people's skills, and not to think that you're the only one that with the skill, and respecting their skill and nurturing those skills, so that you progress together. It's,
mhm.
that's what I think leadership is all about. And I think
Wow.
courage
Mhm.
that you guys are leading the way, and well done with that.
Thank you. Thank you for your encouragement and the very, very insightful sharing today. I mean, it's just a very informal conversation, but I learned so much from you, so many insights, and yeah, there's so much that we really need to educate our community to gain that awareness. So, and I love what you said about leadership is about being nurturing.
Mm,
Yeah, and I guess also as mothers, we tend to have that characteristics in
yeah.
us as well. Yeah, so nurturing the people that we care about, and first thing first, really, we can't emphasize the importance of please take care of yourself first. I know we are, like you said, we are all givers. We love to give, we love to help, but we oftentimes neglect ourselves.
Yeah.
Yeah, and that by that time where again, regarding this particular disease, it will be too late by the time you come to have the symptoms. Yeah. What most alarmed me, what like most caught me was like there's no symptoms.
Yes, that catches most people when I talk to them about that. Yeah.
Yeah, because I was like about to ask you what are some of the symptoms, and then you were
I can tell
you
you
were
the
just
symptoms
saying there's
of
no
cervical
symptoms.
cancer. I can't tell you the symptoms of HPV or pre-cancer because there's none. So
Yeah. And therefore it is really more important and really need to put the screening into our priority of things that we do. We go for dental checkup and things like that. But this is something that we must be on the priority list. All right, so thank you very much, Dr. Ida. I really appreciate your
thank
time
you for
and
inviting
look
me.
forward to seeing you in person on the
I'm looking
27th.
forward to be there as well. I'll see you guys
Yeah.
all there.
Thank you. So, ladies, thank you for watching this session. And if you find that it's beneficial, please do share it. Share it with friends around you, especially women in your life, to so that more of us can be educated. And we really want to, have your support to help create this awareness about cervical cancer, right? And how you can actually prevent it. And the best way to prevent it is to go for your screening. All right. Thank you very much. Right. We'll see you again soon. Bye.